What's up, everyone? This is Dr. Scott coming to you from beautiful Sanibel Island here in Florida. Happy 4th of July weekend to you. I hope you are spending that time with your friends, family, and loved ones, and hopefully getting some quality R&R in. But anyway, I wanted to give you a quick little vlog on femoral acetabular impingement. And the reason why I'm doing this is because this is something I've struggled with treating patients with, but also I am currently suffering with this in my left hip. And so I started doing all the research on this, and there really isn't that much great literature out there as far as effective treatment, conservatively at least. And so there really are two types of FAI, and so there is the cam and the pincer lesion. So your cam lesion is typically an outgrowth of the femoral head, and the pincer lesion is basically the opposite of that, where there is a over coverage of the acetabulum over the top of the femoral head. And so this typically produces, a deep groin pain or even posterior buttock pain. It's particularly with motions of flexion, adduction, internal rotation. And so if you look at from a physical therapy standpoint or physical exam, you can do your fader and scouring test, which basically applies a axial compression to the femur to help compress the joint, while you then bring the patient into flexion, adduction, internal rotation, or even in the opposite motions of that with the scouring test. And I have found this test can be effective at times, but other times it basically misses the diagnosis. You can also get a false positive or even a negative test. For instance, my left hip, I get a negative test to this. So I would, if I was the clinician just doing this test, I would probably miss that diagnosis. But you can also get a false positive as well, because you are basically bringing a joint into the end ranges of flexion, adduction, internal rotation. So it's really not the best test in my opinion. So instead of doing that, I usually have found, or at least what I found through the research and clinically and in my own hip, is doing and reverting back to functional exercise. And so one way that you can do this is have your patients do a deep squat, and if they have, pain in the groin or even the posterior buttock, then you're pretty certain that this patient has got some sort of FAI going on. So do that now with your patients going forward, and so instead of relying on those tests, do the functional test, and I think you'll have a better diagnosis in differentially diagnosing what's actually going on with that hip. So be on the lookout for my coming videos of how I show you how I have modified my workouts and my exercise